Good afternoon. Today we are going to see about the home visit. Home visit is an important aspect in community health nursing, and it is giving an opportunity for the individual nurses to visit in the home. Patient also will be in a condition in a normal state, and nurse also gave an opportunity to look into their economical condition, environmental background, open sewage systems, how the disease, what is the source of infection, and it will be more helpful for the source reduction in case of sudden outbreak of cholera, dengue, malaria, coronavirus, anything. Today we have gathered here to tell about what is home visit, and importantly to how to write a home visit plan in a detailed manner. So can anyone tell what is definition of home visit?
Yes, ma'am. It is a professional contact in which a nurse to visit the family or client in their home to assess, provide care, health education and support.
To prevent and promote the services at the community level. You can end the definition like that, because community health nursing is the nursing taking the knowledge from the discipline of the nursing and taking the knowledge from the public, and application of this knowledge to prevent, promote care in the level of community. So the community level is the root cause. We are reducing the healthcare cost. The country's economy will improve because of reducing the country's healthcare cost. How? Because admission will be reducing. Promotional aspect of the care, because community health nurse is giving a care for the sick as well as the normal individual. Sick people, how to take care of healthy by themselves, and how to refer it, and the healthy people to how to run the journey with the promotions, with the healthy lifestyle, appreciating the lifestyle. Right or not? Setting an example. Okay, what are all the different types of home visits?
The various types are present. It is illness home visit and dying patient home visit.
What is illness home visit?
Various people are fever, and various people are fever, and various disease condition can here. When we have to visit the home, then ask the patient which disease condition, how to feel your
taken long time treatment in primary healthcare center, or there is a postpartum, or that's the purposeful and illness home visit, or the follow up home visit. Next is the
yes ma'am, assessment home visit.
Assessment home visit, that's a postpartum. People are hemorrhage there, and then postpartum period, within that 42 days, only 6 days they will be in a primary healthcare center. Afterwards they will be maximum 3 to 5 days or maximum 6 days. Afterwards ANM, ASHA, USHA or anyone will be visiting their assessment. What do you assess in that maternity? Involution of uterus, how it is, any bleeding, what is their hygienic condition, how they are discarding the pad. Next is the, what is the another home visit?
Follow up home visit.
Follow up home visit. Follow up home visit, for example, TB patient has taken under the DOTS therapy. You know, government also giving some amount of money, so that after finishing also the person has to continue with a healthy diet and a healthy lifestyle. Again, is there any kind of this one? Again, you know, the TB bacteria will be resistant. Then multi-drug resistant therapy you have to start with. So many issues there. So any patients who are consistently taking medication need the follow-up, whether they are taking or not. So it is called the follow-up. Can you narrate what are all the types of home visit again?
Illness home visit, assessment home visit, dying patient home visit, and the last of the hospitalization and the follow-up home visit.
Very excellent. Do you have any aims and objectives of home visit?
Yes ma'am, first of all assessment is there. We should check the which environment the people are living, what is their socio-economic status and how is their health. Then care delivery.
Socio-economic status, mainly purchase power. Right or not? Some villages I go, there is no purchase power. They eat only dal, lentil, which is what they are giving from the ration shop. And pratidin they are eating aloo. They are not taking only muri. If at all they are hungry, they take muri. Muri is called the, what do they call? The pop rice. Puri, we tell in Tamil it's puri. So they eat muri and aloo, and this is the protein. They don't, that is electricity not there. So these are all the opportunity for the community health. So she will act as a link. If the water supply not good, she can inform to the municipality, guide them to go to the councillor. Right or not?
Yes ma'am.
Yes. If not, call the media. Post one post. Then it will be awakening for the political people to see, then they will not get vote in the particular city,
Yes.
particular village. So that's the thing, you will act as a change agent.
Yes,
Right or
ma'am.
not? Yes, next.
Then ma'am, health promotion education, we educated them about the immunization schedule, nutrition, then what disease condition, which type of care is there, that type of thing we are telling. Then care delivery.
To deliver the care.
Yes ma'am, if a patient having the diabetes mellitus, we should check the glucose level. Then if a patient having the hypertension, then we check the BP. That type of thing we are providing in the healthcare. Then relationship building between the community people and nurses. That
Very
is the
good.
objective are there.
To the assess, to give the care, to assess the condition, to promotional care and to relationship building, to trust the trust and linking between this one. These are all the main objectives.
Yes.
Linking why? Get the governmental program to reach the people. There is no awareness. When you create awareness, awareness creates the interest and creates the motivation. Right or not?
Yes.
And then they will participate, then they will achieve it. So the government scheme will be reaching. Right or not?
Yes.
Swachh Bharat, that's the gas, free gas program is there. So many Jandan Yojana, Swachh Bharat Yojana, then government health schemes. You have to they tell that I am having a big disease, that primary health care not giving an opportunity. So you have to get the health card, free health insurance scheme. How they get? This is the objectives of home visit. The nurse will go and tell them. That's the main, very good objectives you have told. Is there any phases of making home visit?
Yes, ma'am. There are various phases are there. First
So
of all,
purpose and objectives will be more or less same. To assess, to give care, to link, to educate, to promote, to refer. That is the purpose. Now it is a phases.
First the initiative phases, then the planning phases, planning or pre-visit phases, then to the home phases, home visit phases or the implementation phases, then the termination phases, and last there are the post-visit or documentation phases.
Phase. Can you tell again? What is the first phase?
Initiative phases.
Initiative phase. What you will do in initiative phase? What is the initiative phase? You will go and explain yourself from where you are coming, what is the purpose of visit, and here is the initiation phase is the trust building. How to trust building? Before knocking the door down, you introduce yourself. How to introduce? I am nurse, who is my name, I come from here, I come to support. This is the initiation phase. Right or not? What is the second phase?
Planning phases.
Planning phase. Once they initiated, the trust is built. Both of you can exchange the information and plan. What is you are in a need? What kind of a need? Is it an economical need, or it is you need any? Is there a child is there? What is their need? If the age of 35, what is their need? The need in the age of 35 is a screening for their BP. If they have any diseases, history of any illnesses, it's coming. Any of their parents died in the age of 45. So what cancer or any diseases, screening, menopause, if the age. So you, according to that, you will be planning phase. Both of you will be working together, understand what is needed. What is the next phase?
Implementation phases.
Implementation phase. Either you need to implement, you take them, or you need to check their BP, give their record, look at their record, and then implement. If not, referral. Referral also a kind of implementation. You just come, this time doctor is available, come. After checking, screening, BP, everything, you found out that it is really abnormal, you got not standing instructions. That's what standing orders we can follow. Emergency medication we can give for headache, vomiting, ORS you can give what is necessary. But chronic illness medication you are not allowed to prescribe. Either metformin, atrovas or any this one, you have to go in a correct by the referral. Doctors also, they are not prescribing by themselves. They will see the biochemical readings. They will send the blood test. According to that, they will adjust the tablet. We are not allowed. Where the limitation, what you have to do, what you have to do. Which one is helping? Standing orders are helping. Are you understanding? That is the implementation phase. What is the next
Termination
phase?
phases.
Yes, termination phase. Termination phase, okay, both are okay. We are cutting the relationship. Okay, sister, anytime you can call. Do you know one thing? The government of Tamil Nadu government, I am from Tamil Nadu, I know here, they are empowering the peripheral level. Central level is the central minister. Healthcare in a peripheral level, who is giving? Asha is giving, Usha is giving, ANM is giving. Government has given ANM, every area ANM, sister phone number is there. You are in a village, this ANM coming, Usha, phone number is given, government is given the number, government is paying the mobile bill. You can call them anytime. For the minor element, IMNCI, many program, they are trained people. How to categorize, they will refer them. So you can anytime, not only during the pregnancy, during the emergency, any emergency they can call. 108 ambulance services are available. You have to tell them. You have to call 108 in Tamil Nadu. What is the ambulance service in West Bengal? You have to inform them. Are you understanding? Termination. What is the final phase?
And the last of the documentation and evaluation phases.
Documentation, evaluation, and do it, and then you can do the follow up after a long time. But the closed area, this one is over. But monthly once you can visit them. Are you understanding? Yes. Now we can see any principles are followed in the principles should be followed in the home visit.
First off is purposeful visit. Purposeful visit means
Principles
home
of
visit,
purpose.
purposeful visit means home visit always have a clear objective. Then planned visit. We planned home visit.
Principles of purpose. Principles of planning. Everything you tell principle.
Okay,
She already told assessment, implementation plan. It's confusion, no?
Yes.
When you are telling, you tell principles of assessment, principles of planning, principles of that. You tell the word principle.
Principle of planning means we
How many
plan the home
principles?
visit.
No need to explain. Just list down the principles of home visit.
Principles of planning, then principles of regularity, principles of flexibility, principles of respectful, principles of participation, then principles of promoting and preventing disease, principles of report and
Principle of documentation. Are you understanding? Principle, no need to explain. In the word itself, explanation. Are you understanding? So these many principles of flexibility is a very important. Because when you go, nowadays all the people, if you go 10 o'clock, important serial is there. They will not tell me, sister, please wait, we'll see the serial. TV program will be going on. So that you have to ask them, when you are coming, your madam, I'm coming, 4 o'clock is a tea time, you come. So I have to adjust according to the 4 o'clock. I cannot tell you off the TV. They are found of, slowly their character will change, but they are found to look at the television, entertainment. So you have to be flexible to take care of them. Slowly, then after once you build a good rapport, they don't want serial. More than that, your felt need they will understand. Till they need the felt need is a television. Then once they understand, they will be flexible to you, then you flexible to them. But in the beginning, you have to adjust with their flexible time. Then they will give importance because it's coming all by the mutual trust. Are you understanding? What is the role of nurse in home visit?
Ma'am, a nurse was assistant, caregiver, educator, counselor, good coordinator, and caregiver provider and health education educator them. What are the prevention, what are the management is there, they tell us. That are the roles of nurse.
So you are an educator, you are a motivator. Sometimes they have lot of chaos in their life.
Yes, ma'am.
That time you should be a listener.
Yes, ma'am.
Half of the time you listen to them, they are extremely happy.
Yes, ma'am.
Either you are visiting old age home, to their community you are visiting.
Yes, ma'am.
So many things they cannot even ventilate, but they feel like ventilate you, sister, and then you can counsel them. Okay, don't waste the time. There are some jobs are there nearby. You can do. You know, in Tamil Nadu, some people every day they flower. You know, flower they will be, or the artificial flower making, or the real flower. This one every day they will get only 100 rupees. It's so happy. It's not a matter of 100 rupees. This 100 rupees earning, which give them self-confidence. I am useful to something. This one given empowerment.
Yes, ma'am.
Even that weekly 100 rupees, they go to the self-help group. So you motivate them, self-empowerment. Are you understanding? What is called empowerment? Empowerment is the process by which every woman empowerment, you take it, mainly woman empowerment. So what is that? It is a process by which the woman understanding, identifying their own need and identify their own problems and try to come out themselves to come out their own problem. That's called empowerment. Or herself coming out. You are going to give something. You are empowering the woman. There is a self-help groups are very beautifully running in Tamil Nadu government. They are giving lot of loans to the women. So these women are making soap powder making, candle making. You put little money, you could make a big profit. You are very famous in Durga Puja and Kali Puja, and the mud is very cheap here, no money. Are you understanding? You can tell them, motivate them. What all the chances are there? You can lamp, small lamps you can make it. That's for 1 rupee, 2 rupee. Even you make it, paint it, it will be high cost. You raw this one. Or cup. In West Bengal, everybody is drinking by the mud cup and they are throwing. You can make it mud, this one. So even nothing is available. Cow duck available. Cow duck, take the cow duck, put some straw, put it some wall. You are making your own fuel, right or not? So you can empower whatever. In Russia, how the woman empowerment, Russia from CMC Vellore, we have went how they do. You have to empower every individual in the home visit. They just give one goat, maybe the female goat to the baby. Then it will, every 6 months, goat will be yielding 4 kittens, 4, 5, like that they will be yielding the small babies. So that one, another 2 years, they will become rich. Everyone wants to eat mutton, especially in West Bengal. Mutton shop every day busy. Right or not? I buy only monthly ones, but even they are the workers, they want to eat mutton 3 days once they are eating. Brahmins are eating in a fish, so fish pollute. How you can, with nothing you can empower them, and motivation is important. So hope you understand what is the definition of homicide, types of homicide, purpose of homicide, principles of homicide, role of nurse in a homicide. Phases of homicide: initiation phase, working phase, right or not, termination phase, follow-up phase, like that they told. So you can, any 5 mark or question coming, 15 mark question coming, you can write it. When you are telling principles of planning, principles of flexibility, principles you have to follow, principles of communication, principles of confidence, principle of supervision, many principles have to be added. Understand? Okay. Now do you have any doubt about how to write a homicide?
In community posting, I have seen one child, her age 8 months, and she is suffering from cold and cough from 3 days. Then her mother told me
1 year?
8 months.
8 months?
Yes.
Cold and cough or diarrhea?
Cold and cough.
Cold and cough?
Yes. And her mother told me she has unable to eat when she take breastfeeding. Her breathe is deeply and take difficulty in breathe, and some problems are.
Yes, some problem for the 1 year old. First, how you have to make a homicide? First, you have to write the name of the baby. You have to write the baby Mala. The age is only 8 months. It is coming category of infant classification. Then address. This is the first. Then you have to draw the column. In the column, you have to write first is the problem and the need. Problem is now is difficulty in breathing. Right or not?
Yes, ma'am.
Cough and cold, chest congestion, difficulty in breathing. There is a child is suffering to breathe it. You are not supposed to write it as a diagnosis. It is a problem only we are writing. Then in this column, need you have to write. For the 8-month-old baby, her need is vaccination. Need to vaccinate, need to prevent the injury, breastfeeding,
yes,
right or not? And prevention of the accidents and the injury, falling, dropping, and any choking problem, because this child will be taking, and the personal hygiene. These 5 needs are needed for this child. Now come to the point. Now this column is over. Problem and the need. Then next is a short term goal and long term goal. Short term goal, what you have to do? In a short term, what is the intervention I can give for the baby to come out from the cold? Are you understanding? Since it is a child, if it is available, you can make the camphor oil. Camphor oil you can prepare. You can prepare the camphor oil. You can take a coconut oil, little, you put a camphor inside. Then apply this camphor oil in the chest of the child. Right or not? Advise the mother to give the warm food, not a cold food. Right or not? Then you have to give them that steam inhalation.
Yes.
Eucalyptus oil available. Something you can give them steam. And you have to do the physical assessment. First you have to collect the history, do the physical assessment, and the camphor oil you can apply, or eucalyptus oil or camphor oil you can prepare it. Then eucalyptus oil, if it is a steam is able to this one, you have to make the child to do this one. If not, if fever are there in your physical assessment, you can give them paracetamol syrup and check the temperature, and this one. This much is the intervention. And health education, you will give about the long term, about the vaccination, right or not? Whatever you have need for the need, that you will give the health education. Right or not?
Okay.
Every health education, next column, pre-teaching, post-teaching. Any health education you are giving, pre-teaching, you have to know KAS. What is KAS? Knowledge, attitude and skill. The knowledge, the mother have the poor knowledge regarding about the taking care of the child with any respiratory, this one. So you have to educate them. You have, during this winter time, you have to cover. And it does need any skill to give the steam inhalation, because the child will be very this one active. So you can, there are now 300 rupees only, the steamer is available, you can promote them, they can buy it. There's a steamer, no, you go beauty parlor, steamer is available, that you can give the child, the natural steam will be going. So it does need skill. So you have attitude, the mother have a very poor attitude. When this mother is having, he has a poor attitude and laziness to go to visit the doctor. Then after education, mother developed the attitude. So understood now?
Yes,
What is
ma'am.
her problem?
Yes,
One problem, one day. First name of the child, other things, classification, address, and then problem and the need. Problem is the today's problem. Then today's the problem down is short term goal. Then need is the long term. During the particular, what is the need of the baby? Education, prevention of ARI. Why I have to prevent ARI? What is ARI? Acute respiratory tract infection. The child lungs is not developed completely in the womb. When the child born, the alveoli, there is called surfactant. Especially premature child, there is not at all there surfactant. If the baby born premature coming, even a 8-year lung development is still maybe delaying. So this surfactant is not completely okay. So that surfactant help to prevent the ARI. So you explain the mother, no need to be panic, because your child is always getting ARI, because lungs is not developed. During this cold climate, we are nearby Himachal Pradesh, yes, right, nearby Darjeeling. Wear the good cloth and cover the ear and cover the chest. Mostly pneumonia can be prevented. And don't wait 1 day, 2 days, camphor oil will do. If not, take the child, otherwise child will end up with pneumonia. Understood?
Yes,
Any
ma'am.
other problem? Any other come across how to write? Now you will understand how to write a homicide for the less than 1 year baby. It's called the classification of infant. Next is a
In community, I visit a home where a children 3 years old.
child with a 3-year-old.
She looked very weak and tired, and her mother complaining that she passed water stool more than 3 times in a day, and suffering from vomiting and abdominal pain. Ma'am, can you tell what are the management and
Yes.
how I write the home visit
Yes,
plan?
home visit plan. First you will write the name of the child. Then you will write the classification. What is the age? 3 years. So she will come under the category of
A toddler.
toddler. What is preschooler? 3 to 6 years. 1 to 3 years is a toddler. So her problem is a loose motion. You will not start diagnosed as a diarrhea. Passing loose stool for more than 3 times. Right or not? It's all not called diarrhea. 3 times, sometimes it's a detoxification, it's okay. But still, when the child body mass index is so small, even 3 times, 4 times, child will go for the deterioration. Shock. Right or not? Hypovolemic shock. Here is the point. This is the problem. Here need is 1 to 3 year. Mostly they will be crawling, sometimes walking, jumping, fall into the water, cover this one, they go and poke into the accidents, more chances are there. Still ARI is the problem, and they put everything in that. These are all the need for them. Prevention of accident, prevention of incidents, right or not? Then prevention of acute respiratory tract infection. You have tried, because still 8 year, the child, any child, prevent. You have to take care of them. Then now we will come to that diarrhea. She passed it. Now you have to do the short term goal, physical assessment, history collection, physical assessment. Then you will skin fold thickness, check the skin fold thickness, look in for the sunken eyes, how this may be, dryness of the mouth. And if the mother is breastfeeding in 2.5 years, continue with the breastfeed with a hygienic manner. And doesn't need any skill. It does need to prepare how to prepare the ORS solution. If not, they have the phone number to the ANM. Here the government is making the ORS corners. No need even you make. Anyway, you are going to teach ORS in emergency. You know how to teach it. Then if not, there is a corner, you can call them, they will give So you have to importantly teach them how to consume. This should not take it for more than 24 hours. If not, you prepare for the baby, not 1 liter you prepare. You prepare for 200 ml and how you have to prepare it and finish it, consume it. Before preparing, the water should be very clean. How to clean the water? Household boiling method. Boil the water, warm and cold, make it little warm, lukewarm water, then you put the ORS solution and give the baby this water continuously, then the normal water. Tell her to continuously breastfeed. So this is about the knowledge. How is the knowledge? Here is we have written now problem and need. Short term goal, long term goal. Long term goal, educate about the vaccination, educate prevention of accidents, prevention of family planning. Also you have to tell the mother, because 3 years, how many children, how many child, that you have to give them. Then we will be coming to the teaching, pre-teaching, post-teaching. My teaching does need KAS. What is the knowledge, attitude and skill? Attitude, but any illness continuing more than 2 days, attitude towards approach the primary health care center, approach to the sub-health center, not keeping the child with any incident. Tell them not to jump the doctors. Go to one doctor, because in the chamber in West Bengal, they don't have the time to hear the history. That's what we lost one of our students. One doctor they are going, they give medicine, 3 days fever is not finished, not going to the same doctor, going to the another doctor. Another doctor do not have the time to inquire about previous treatment. They give another, that is also not work. What happened? Within these 7 days, the microorganism enter into the blood, septicemia and meningococcal meningitis. Easily prevented. Same doctor, sir, this antibiotic not working. Are you giving antibiotic? Or I have taken paracetamol, whatever it may be. History collection is very important. Half the good history collection, half of the diagnosis will be done. Either you are a doctor or a nurse or pharmacist or anyone, you have to collect the history before doing anything. Any other doubt with you?
Yes, ma'am. During our community posting, ma'am, I visit a home and there was an old woman is there. Her age was 60 years old, and he told me when we eat a food, after some time they got vomiting and they does not digest the food.
Yes, problem here is the indigestion and vomiting. Indigestion, where problem? You write it, name of the mother, coming is the old age.
Okay, ma'am.
Okay, or if it is less than that, old adult, you write it. If above 65, you write as a old. Okay, then you will write the classification, and problem is vomiting with indigestion and vomiting. And his need is prevention of multivitamin, prevention of long-term illnesses, control of the long-term illnesses, chronic illnesses, prevention of delirium, dementia, psychological diseases, and give the vitamin-rich tablet and giving supplementation. Okay. Right or not? Already they are in the stage of diabetes and hypertension. You might have collected the history, and the continuation of the tablet, follow up every 6 months, check up their level of the sugar or this one. Then short-term goal, long-term. Now the short-term goal, she is having the indigestion and vomiting. Yes, so you have to give her indigestion, some Gelusil and all standing instruction you can give her, but it is not the remedy for that. Ask her to take the small and frequent food. Tell her, if again indigestion or tummy, you have to tell her, if you take this Gelusil, how to take this Gelusil, and still it is not present like this, and you have to come with this number, follow up, because maybe some gallbladder issues, indigestion mainly, gallbladder, bile salts, yes, big bands are playing a main important role in a digestion of the food. When the food is coming into the stomach, gallbladder is not opening sphincter of Oddi. When the food is coming from the stomach to the duodenum, immediately sphincter of Oddi open, it is pouring the thing. But what happened? Some problem, some gallbladder is only this much, but doing a big job. Equal to like our liver, big organ doing the job, this is small organ doing. These enzymes and these hormones, whatever, CCK, all these hormones are helping to digest this. So where is the problem? Is it in a gallbladder, or is it in a absorption? Is it in a small intestine? Is it a colitis? It is a differential diagnosis. So it does need, can you diagnose that? You cannot diagnose. You can give standing instruction, give a Gelusil, ask her to take a small and frequent diet, ask her to sit for sometimes, take her food, then you have to give the referral. Understand? Yes, now will be understood her need. Her need is different, her problem and the short term goal. And will be KAS. KAS will be knowledge, attitude and skill. How he has to prepare and what is that you have tried. Knowledge, attitude and skill. Any other thing?
Yes, ma'am. In our community posting, I visited in one home. There are one woman. Her age is 58 years old. She told
58 all same, 60.
Okay.
You can tell adolescent girls. Category is over, right or not? You told about infant, you told about toddler. 58, 60, same thing you are going to do. What is the problem you faced?
She told that she is feeling very tiredness and dizziness.
Yes, tiredness also she is feeling. Tiredness, giddiness, all these things in the age of 58. Mostly this is the signs and symptoms of anemia. Okay, here is the point. Mostly adolescent girls also feeling this one. How the mother will be telling? Any children anemia is 54% in India. The main complaint they will tell tiredness. So their hemoglobin level in the blood is very low. Understand? So you have to tell her before any anemic treatment better to deworm. Deworm tablets in a standing instruction you can give it to the woman. So you give her 2 doses. You know what is the tablets for deworm? Albendazole. 400 milligram albendazole. 1 day tablet it is not going to useful. So here is the problem is the mother is feeling tired. The tired you will be the short term goal. Need will be different. Need whatever I told the old age, same need. Screening for hypertension, screening for diabetes, screening for Parkinson's disease, all these things, psychological depression, everything you have to do. But in a short term goals, what you have to do? You have to look into for the science history collection. Then look into for signs and symptoms of anemia. Then ask her to take the dates if she is not if she is not a known case of a diabetic mellitus. Are you understanding? And drumstick leaves. I do not know what is sojna leaves. Useful for even diabetic, hypertension, anemia. One solution is a sojna leaves. That's called drumstick leaf. Beautifully explain her. Does need skill? Yes. Does need skill to prepare the soup of sojna. Tell her how to prepare the soup with pepper. Pepper, even an enemy's house you can go with the pepper. Even their poison is not going to affect you. That is the one proverb is there. So you give her how to prepare it. Then you can refer her and give any vitamin tablets. Mobilize the vitamin tablet because these people need any multivitamins. Tell her to motivate, prescribe her multivitamin tablet, prescribe her deworm. You take first tablet and give 3 days gap and second albendazole. Then you start with the iron and folic acid tablet and ask her to come once for the referral to check this hemoglobin. Are you understanding? They are very happy. So we are here following standing instructions, standing orders. We are giving the tablets. No harm. Giving one paracetamol, giving a deworm. We have to exercise our power to help others. No harm in it. So hope you have understand. So various scenario, finally I am telling, write it, the name and classification, problem and need, short term goal, long term goal. Short term goal for towards the problem, long term goal according to the age scenario. And then pre-teaching and post-teaching, KAS. KAS is a before teaching what is KAS, knowledge, attitude, skill towards our healthcare. And then after your teaching is changed or not. If not changed, again replan. Redo the home visit. With your superior, bring your teacher, bring some credible person to educate them. Don't leave the community. Because community we are building very strong. India's healthcare cost is going to reduce. India's healthcare system, not only by the government, many private hospitals are playing a vital role to take care of the Indian people healthcare system. So you have to motivate them, whatever the healthcare it may be, create our awareness, any bodily changes to approach you, ventilate you. Moreover that you must act as a change agent. Not always you are there to guide them. You have to act as a change agent. Right or not? Rather teaching them how to eat the fish. You teach them how to catch the fish. You are not there, they will catch the fish and they survive. So catch them, tell them where to approach, when problem, how to go. Create an awareness because they are all non-literate people. We are not supposed to say illiterate. Illiterate, the word is not good. So we are telling non-literate people. Non-literate people, you are creating awareness. That awareness is called NAS as a change agent. Hope you know how to write the home visit. Follow and subscribe our videos and follow us for the more information to give the best care for the community and the healthcare setting. Thank you. You understood?